In this presentation, we will be focusing on infection control. Infection control is important in dentistry because it prevents the transmission of infectious diseases between patients and the provider, creating a safe environment for everyone receiving and providing care. It's also effective because it protects the integrity of dental hygiene services by reducing cross-contamination, promoting patient trust, and ensuring compliance with patient standards and guidelines. These are the learning objectives in which you are expected to know and understand by the end of the presentation. Now, I've already lectured on this, so I am not going to be going over all of the learning objectives, but you can refer back to your previous PowerPoint presentation that I gave you to review these. To understand infection control, we have to understand the infectious agents. Infectious agents are organisms that are capable of producing infection or an infectious disease, and there are 4 types of agents. You have bacteria, viruses, fungi, and protozoa. For your bacteria, it is a single-cell living organism that is found in every habitat and environment. Viruses, this is important to know, that it's non-living, as they can only replicate within a host. A host is a person, an animal, or another organism that provides a place where an organism can live, grow, and multiply. But it's important to know that viruses are considered non-living unless they are, connected to a host. You have fungi. This is single or complex multicellular living organisms. And then you have protozoas that are single-cell organisms that can cause parasitic infections. So in order for our bodies to protect itself, we have what we know as immunity. And immunity is when our immune system develops antibodies to eliminate an infectious agent. There are 2 types of immunities that we're going to focus on. The first one is passive. Passive immunity is a protection from one animal or person to another. This provides immediate but temporary immunity. I want you to think of as the example, mother to a newborn. Okay? As the mother is impregnated with the fetus, it is passing on immunity to that newborn. But then as the newborn is born, over time, it loses that immunity, and this is where vaccines are so important. The other immunity is active. Active immunity is the protection acquired in the body by having the actual disease or by a vaccination. So the protection takes time to develop and can provide lifelong immunity. So an example would be as a child who has contracted measles and they have now recovered. Or if you have received a vaccine and you have received a lower count of that type of bacteria or virus, and your body has now been able to produce those antibodies against that disease.
So we know that active immunity is a form that can be used by vaccination. And vaccines, these are a product to provide immunity by stimulating the immune system to produce antibodies to a specific infectious agent. It can be administered orally or through injection or through nasal. And the more similar of a vaccine to the infectious agent, the better the immune response to the vaccine. So there are 2 different types of vaccines. We have the live vaccine and the inactive vaccine. The live vaccine contains a weakened form of the infectious agent. So this is actually the infectious agent, but it's weakened. Now the good part of this is that when it's injected or placed into the host, the body provides or produces the antibodies for that particular infectious agent, such as the measles, the mumps, or the rubella, the MMR. The varicella vaccine that you see here, that is for chickenpox. So varicella vaccine is the chickenpox vaccine. And the live vaccines offer long-term vaccinations from this vaccine. So it's long-term, it's lifelong immunity. Inactive vaccines, this contains whole or a partial part of the inactive infectious agent. It may not last as long, and there might be boosters that need to be done throughout the lifelong of the vaccine. So you might have to be rechecked for the immunity, and if the immunity isn't there, then you might have to have a vaccine booster, such as like for hepatitis A. The main thing to understand really is that vaccines is the most effective way to prevent many serious infectious diseases. So they are very, very important for our overall immunity. Now, believe it or not, when we are born, there is no microorganisms in the mouth. The oral cavity is sterile. But right after birth, microorganisms are transmitted into the infant's mouth through the mother, family members, caretakers, and the environment. So it has been estimated that the oral cavity represents over 700 different types of microorganisms in it. And a lot of these bacteria is really important because this bacteria allows us for digestion to occur in the mouth. So since now we know that we have bacteria in our mouth, and now as dental hygienists, we're going to be working in the mouth, and we understand what infectious agents are, now we have to understand a little bit how this cross-contamination happens. Cross-contamination is the spread of microorganisms from one source to another. It can happen from person to person, or a person to an inanimate object, and then to another person. So it's important to recognize that possible transfers of transmittable diseases provide the basis for planning the system for disinfection, sterilization, the management of instruments, equipment, and the environment. The disease transmission within dental faculty may cause from inappropriate work practices such as careless hand washing, unhygienic personal habits, inadequate sterilization and handling of sterile instruments and materials, or inadequate or inappropriate personal protective equipment, or just a lack of infection control processes. So we need to make sure that we understand what cross-contamination is, and not necessarily, cross-contamination is very normal, it's very common, and yes, it's going to happen. The main thing with cross-contamination is to know when it happens. And when it does happen, what are we going to do to fix it? Obviously, the gold standard is to prevent all cross-contamination from happening, but in the event that there is cross-contamination, it's more important to understand what just happened so we can fix it so the cross-contamination chain is broken. So as I just stated, when it comes to cross-contamination, it can occur in the dental field, and it does happen due to careless hand washing or unhygienic personal habits, inadequate sterilization or handling of sterile instruments and materials, or the inadequate or inappropriate personal protective equipment. So how do we prevent cross-contamination? We prevent it by the use of standard precautions. Standard precautions used to be known as universal precautions. So for people who have been in the dental field, you might have known this as universal precautions, but now it is considered standard. And what this means is it is the minimum standard of care to protect us as the clinicians from transmission of diseases. Basically, what this means is we are going to treat all patients as they are infectious. The reason for this is because there are a lot of infection diseases that patients don't know that they have. Maybe they don't have any signs or symptoms and they don't know that they're carrying the disease. Or maybe they do know that they're carrying the disease, but they have just chosen not to tell us. And so Because of these, we do have to treat every single patient as infectious. This applies to any procedure that involves blood, saliva, or any bodily fluids, broken skin, or mucous membranes. So we're going to be learning how do we do the standard precautions? How do we treat every patient as infectious to prevent any transmission to us? So we need to understand the chain of events that is required for the spread of an infectious agent. So the chain events require the infectious agent, the reservoir, the port of exit, the mode of transmission, the port of entry, and the susceptible host. So let's start off with the infectious agent. That would be like a bacteria or a virus. And each infectious agent has its own specific reaction in its infected host. Now, the reservoir is where the infectious agents are found in their own essential environment, which may be an instrument, it could be a dental water line, or it could even be found in blood. The port of exit, or the mode of the escape from the reservoir, the infectious agent exits from the reservoir through the modes such as coughing, sneezing, or speaking. It could be a needle stick or a puncture. And then that may be in direct with the person to person. So that's the mode of transmission. And that can be from, like I said, person to person. It could be indirect by a contaminated hand, or it could be a puncture. Then it goes into the port of entry, or the mode of entry of the infectious agent into the new host. Then the host is like, think of the host as it needs to be a being. So it needs to be like a human, or it needs to be an animal. The susceptible host does not have the immunity or the defense of the invading infectious agent. So a patient taking maybe, immunosuppressive drug, or maybe they just had an organ transplant, or they're on chemotherapy, they're susceptible because their immune system is already compromised. So we need to keep this chain of events, and we have to break the chain. As you can see in the diagram, kind of where those little blue arrows are, that's the break in the chain. If we break the chain, then the spread of infectious disease stops. So the idea is to always break that chain. And like I said before, understanding that if there is a cross-contamination that has occurred, to be able to recognize it, to break that chain. There are a few transmissions that we need to be aware of as being in the dental field. So the first one would be airborne transmission. And this can be transmitted through aerosol, droplet, or spatter. It can be solid or in liquid particle, and it's suspended in air. This can be, you can come in contact with it through the mucous membranes, through the eyes, the nose, and the mouth. This can occur through coughing, sneezing, speaking, even laughing can actually have this happen. And it also happens in the dental clinic when we're doing procedures that are producing aerosols. Bloodborne transmission is the other one we need to be concerned about or aware of. So bloodborne pathogens are microorganisms that can be transmitted to anyone through exposed, contaminated bodily fluids. Since we're going to be working in the mouth, we are in contact with bodily fluids such as blood and saliva. And just please make note that even though you may not see the blood in the mouth, it does not mean that blood is not within saliva, okay? So even if you're like cleaning somebody's mouth, you're like, no, I didn't see any bleeding today, does not necessarily mean on a microscopic level that there isn't some kind of blood in that saliva. So we're always going to be treating everything as it's infected with blood. Bloodborne pathogens can be transmitted accidentally through through punctures with our instruments. It could also happen with a needle stick. We could have little cuts or abrasions. It could happen if something gets spattered in our eye. So we just need to make sure that we are, adhering to our standard precautions and making sure that we are doing everything we can to protect ourselves. When it comes to infectious agents, one that we want to be aware of is hepatitis. Hepatitis is inflammation of the liver. Hepa meaning liver, itis meaning inflammation, inflammation of the liver. There are 5 different hepatitises. We have hepatitis A, which is fecal oral ingestion. This is where somebody in dealing with food hasn't washed their hands after they've gone to the restroom, and now they are handling food and then you eat it. For hepatitis B, this is bloodborne. Though we are all vaccinated for hepatitis B, so this isn't something we get too concerned about because we are vaccinated against this one. Hepatitis C, this one is also bloodborne. The thing about hepatitis C is that this does not have a vaccine. There's no vaccine to this hepatitis. So if there is a puncture or if there is a needle stick and the patient could have hepatitis C, this would be something that we would be a little concerned about. But the risk of getting hepatitis C from a needle stick or an instrument puncture, I think it's 0.7%, so it's very low. For hepatitis D, you can't have this one unless you have hepatitis B. And then hepatitis E is also the same as hepatitis A. The thing about hepatitis is that it can lead to liver failure and it can lead to cirrhosis or an increased risk of liver cancer. So the main thing to understand is that hepatitis C is bloodborne. There is no vaccination. We do get vaccinated for hepatitis B, and that hepatitis A is that fecal oral ingestion, and that is the inflammation of the liver. We do need to be aware of the human herpes virus. There are 4 types that we need to be aware of: herpes simplex type 1 and 2, varicella and zoster, and the Epstein-Barr virus. For the herpes virus simplex type 1, the primary infection is primary herpetic gingivostomatitis. If you look on the pictures of the child's mouth, that is a classic little one that has primary herpetic gingivostomatitis. This is herpetic lesions throughout the entire mouth. It's very painful. And if you were to see a patient like this, we would definitely dismiss them and allow that little one to heal. It affects about 50 to 90% of people. And the latent infection, which you do need to know, occurs in the trigeminal nerve. The trigeminal nerve is where it's in the face. You'll learn this more in head and neck anatomy. When you do have herpes simplex type 1, it is a virus, so recurrent infections can happen. Herpetic whitlow, if you look at the upper right picture, that is where this finger has been intact with a herpetic lesion, and now it's infected the finger. You have ocular, which is herpes within the eye, and then the one that we probably are all most familiar with is the herpetic labialis, which is going to be the lower right, and that is that's what we normally are aware of. So the thing about the herpes simplex type 1, when these lesions occur, if they are oozing or kind of pussy, this is where they are the most highly infectious. And if you see a patient and this is happening, we have to dismiss the patient. And the reason for it is because of the highly infectious state that they are in. And we do not want any type of that mucus to land in our eye or on our finger or anywhere, because it can be transmitted. Now, if the lesion is crusted, then it is no longer in an infectious state, which means that we can see the patient. We want to put some Vaseline on this area because it's going to be kind of crusty. We want to do what we can to prevent the cracking. But honestly, most patients probably will reschedule because it can kind of be uncomfortable opening their mouth depending on where the lesion is. For herpes simplex type 2, this isn't something we see a whole lot of. This is commonly known as your genital herpes. It can cause perioral infections as well. Perioral meaning around the mouth, outside of the mouth, above and below the lips, maybe even a little bit on the cheeks. Not something that we see a whole lot, but it can happen perioral. For needle nail, that is serious. This can actually delay developmental mental development. It can cause blindness, neurological problems. I mean, even death can occur. The good thing is that there's a lot of antiviral therapies that can be done to help control it. And I know that there's medications that can help prevent them from even beginning. Herpes simplex type 3, this is going to be your varicella zoster. Varicella is chickenpox, okay? Chickenpox is children, okay? So CC, chickenpox, children. And then you have zoster. That is the shingles part of it. And shingles happen in adults, okay? So the top picture that you see is going to be your chickenpox in children. And then the lower one is going to be the zoster, the shingles, and that's going to be in adults. That usually happens kind of in the midsection towards like the back. So this is a very common vaccine that's happening. And so yes, varicella, zoster, herpes type 3. Last is going to be your EBV. This is your Epstein-Barr. If you've ever had mononucleosis, you have had the Epstein-Barr infection. So that's pretty much the only thing you need to know about this one. I put, some main symptoms of infectious mononucleosis, but know that the Epstein-Barr causes the mononucleosis. For human papillomavirus or HPV, the best thing about HPV is now they do have a vaccine. There are over 200 strands of the HPV strand, and the only one I need you to know about is number 16. The HPV virus number 16 is the leading cause of oropharyngeal squamous cell carcinoma in the United States. And this is a form of oral cancer. So if a patient has written on their medical history that they do have HPV, it is important that we ask what strand. And if it is HPV 16, then we need to take the appropriate measures to educate the patient on what things to be aware of. HIV and AIDS. HIV, how this virus works, it's a very virulent virus, but it's not very stable. What I mean by that is that it attacks the body system, specifically the CD4 T cells. I want you to know that. It's the CD4 T cells that are affected by this virus. And these T cells are the helper cells. The helper cells help the body create immunity. Well, the HIV virus destroys that, and it decreases the immunity within the patient. This can be sexually transmitted. It can also happen through blood. It cannot be transmitted, though, through saliva, sweat, or tears. So please know that it has to be blood. Now, when I say that it's virulent but not stable, what that means is that it needs a host to survive. And it needs to be at a certain temperature to survive. So when oxygen hits the HIV virus, it starts to become weakened and dies. And so right now in dentistry, there is only a 0.3% chance of contracting HIV through any type of an exposure. And to date, there has been no reported cases that HIV has been transmitted from a patient to a clinician. So yes, it is a risk, but with any job, there's always risks, but the risk is extremely low. So how do we protect ourselves from these infectious agents? And it is through, again, standard precautions. I just copied and pasted the other slide. That is how important it is that you guys understand standard precautions, okay? It's the minimum standard of care to protect us, right? We're going to apply this to all procedures and all patients, and everybody is infectious, okay? This includes, again, blood, saliva, and all bodily fluids. So how do we protect ourselves? Okay, so we already started protecting ourselves when we got the hepatitis B vaccine. Okay, maybe you've already received your MMR. Maybe you have already gotten your varicella zoster or your influenza or your tetanus. So these are some of the vaccines that we can do to help prevent us from those infectious agents. The other way is something called PPE, or also known as personal protective equipment. Personal protective equipment is going to be your protective clothing, your scrubs, your clinical gown, which we will provide for you. We are going to make sure that you are wearing your OSHA compliant footwear. Your hair must be up. Doesn't necessarily need to have a covering, but your hair needs to be out of your face. So if you tip your hair down and your hair comes past your eyes, you got to pin it up. Okay? Headbands, bobby pins, and your hair can't go over your shoulder. So, buns, braids, all of that works just fine. If you want to do a head covering, you absolutely can do that as well. Protective glasses, I know you guys all got fitted for your loops, which is fantastic. And then masks, we do use a level 3 surgical mask. And then of course, gloves. So we just kind of talked about the protective clothing. For your clinical gown, it cannot be worn outside of the clinical area, so think of it as, if you leave your patient, and you're bringing them to the dental receptionist, don't wear your gown. You wouldn't wear your gown to your car. You would not wear your gown to the bathroom, right? So if you're leaving the clinical area, you have to remove your gown, okay? We already talked about the footwear and the hair and the head covering. Protective eyewear, safety glasses or loops, they should be comfortable and light. If you see on the lower right hand picture, you're going to see that there is plastic side shields. Side shields are required. Your loops already have them fabricated into them, but you do have to wear those side shields. Patients also are required to wear safety glasses. We all get one set of eyes and we have to protect them. Masks, again, we're going to use a level 3 surgical grade mask. This new mask is done for every single patient. Also, if it becomes wet or soiled, it needs to be changed. Never place your mask under the nose or the chin, okay? If you're wearing a mask, wear it for the right reasons and the right way. If you were to wear it underneath your nose, you're still breathing through your nose, right? I mean, you're not protecting your nose. So then there's no reason to even be wearing the mask. And if you are placing it underneath your chin, you might as well just throw it away, okay? So when your mask is on, you wear it for the purpose that it's used for, and we're going to place it over the nose and the mouth and behind the ears, okay? The mask should fit nice and snug around the entire edges of the mask, and face shields are optional. For your gloves, they should fit well, okay? They shouldn't feel over tight. As you can see on the right side, the glove is clearly too big. There's just too much material at the tips of your fingers. So when we are in lab and clinic, we will make sure that we understand what size glove you are. We have extra small, smalls, mediums, and large, and extra large. So we do have a glove that fits you, but we don't want them to be too tight and we don't want them to be too loose. The types of gloves, the top one are the nitrile gloves. Those are going to be your patient use gloves. They are single use only. If they become torn, if they tear in any way, you need to wash your hands and you're going to put a new glove on. For your utility gloves, I know you all received these already. Everyone should have 3 pairs. The reason for your utility gloves is these are going to be your heavy duty puncture resistance gloves. You are going to be using these gloves anytime that you're disinfecting your unit or when you're transferring contaminated instruments. So the most important thing that we need to understand is hand care. And this is what we are going to be doing our first skill assessment on in lab. Hand care is so important because the fingernails serve as a reservoir for microorganisms and could result in cross-contamination. Okay, so no artificial nails are allowed. If you have nail polish, clear nail polish is okay. Cuticles must be maintained to prevent any cracks or breaks. Simple bands are permitted. And if you do have any jewelry on the wrist or anything, I just don't want to see it. So I know that permanent jewelry is very popular. It's fine. Just make sure I can't see it. The best way to determine if your nails are too long is if you hold up your hands and you look at the palms of your hands and look above. And if you can see your nails, they're too long. You have to clip them. Hand hygiene overall reduces the bacterial flora of the skin and to prevent cross-contamination, which is critical, right? We want to reduce that bacterial flora because it helps reduce that transient flora for possible cross-contamination. And it reduces, eliminates the dirt. Okay, so there's 3 types of ways that we are going to ensure that we keep our hands as clean as possible. So we have a routine hand wash, which is 2 cycles of 30 seconds, which is we're going to be washing our hands for a total of 60 seconds. The antiseptic hand wash is a total of 15 seconds, and the antiseptic hand rub is going to be until we're going to rub our hands until our hands are dry. So when do we perform hand washing? Well, we perform it before and after treating every patient. We also perform this before or after removal of our gloves. So anytime you take your gloves off, you have to do some type of hand hygiene. Okay? Before regloving, after removing the gloves that are torn, cut, or punctured, you have to perform hand hygiene. After touching an inanimate object that might be contaminated with blood or saliva with ungloved hands, you have to perform hand hygiene. If you notice that your hands are visibly soiled, please wash your hands. Or before leaving the treatment room, please perform hand washing hygiene. So let's talk about the routine hand wash first. This is the hand washing procedure that you will be graded upon in lab. So your routine hand wash is to be completed prior to any dental procedure. Okay, so we're going to wet our hands with water and we're going to apply a full pump of liquid soap. We're going to rub our hands together for 30 seconds and we're going to cover all of the surfaces. We're going to try to get underneath our fingernails. We're going to rub our hands together and we're going to interlace our fingers. We're going to rub on the top of our hands. We're going to rinse underneath our water until all the soap is removed. We're going to reapply a full pump of soap and we're going to do the same process for another 30 seconds. We're going to get underneath our nails. We're going to interlace our fingers. We're going to rub our palms, the back of our hands, and our wrists, and then we're going to rinse our hands, and then we're going to dry our hands from our fingertips to our wrist, okay? Fingers to our wrist, and the reason why is because our fingers are the most clean at this point, down to dirty. So clean to dirty, okay? So fingertips to wrist every time. The antiseptic hand wash, this one must be completed with an antimicrobial liquid soap. One full pump. You're going to interlace your finger. You're going to wash your hands for 15 seconds. Same thing. You're going to rub your hands together, interlace the fingertips. You're going to do the back of your palms and your wrists. You're going to rinse until all of the soap is removed. And again, dry thoroughly from your fingertips to your wrists. The last one is the antiseptic hand rub. Every unit has one of these. This can be used when you are in patient care. So say you're in the middle of your patient and you have to go and grab something out of your drawer or something. You can use this antiseptic hand rub, okay? You're going to use a full pump and you are going to vigorously rub your hands together until they are completely dry. No waving your hands in the air, okay? The alcohol-based material that is in this solution needs to be broken down. And if you're not vigorously rubbing your hands together, it isn't breaking down to kill that bacteria. Please be aware that there are patients with latex hypersensitivities. Though we do try to keep everything latex free, there are some equipment that may contain latex, which I have a list right here for you. The main reaction that we do see with latex hypersensitivity is some type of dermatitis. But we do have to know what the reaction is, because if the patient has like an anaphylaxis reaction, we do need to make sure that we are completely using latex-free equipment. So if you do have a patient with latex hypersensitivity or an allergy, that is something that we absolutely definitely need to take into consideration. So when you see a red circle like this that says board alert, this means that you 100% absolutely need to know this. Not optional. I guarantee it will be on my test. I guarantee it will be on the national board exam. So these are things that are a must. So let's talk about donning first. Donning means on. This means this is how you're going to put on your PPE. Okay? So donning, here's your order. Your gown goes on first, then your mask, then your eyewear, then you're going to wash your hands, and then you're going to put your gloves on, okay? And we will practice this in lab, okay? Again, donning. Your gown goes on first, then your mask, then your eyewear, then your hand washing, and then you're going to put your gloves on. Doffing. This is how you're going to take off your PPE, okay? The order is kind of reversed. You're going to take your gloves off. You're going to hand wash, okay? Remember, anytime you take your gloves off, you have to hand wash, okay? Then you're going to put your eyewear on, or it's how you're going to take your eyewear off. You're going to take your gown off. You're going to take your mask off, and then you're going to wash your hands again, okay? Again, the order of doffing. Gloves first, then you're going to hand wash. Remove your eyewear, remove your gown, remove your mask, remove, sorry, you're going to do your hand washing, okay? Now that we have understood how to protect the clinician, now we have to talk about how are we going to protect us and the patient in the clinical environment. So let's talk about the treatment room. The treatment room is going to have a patient chair. It's going to have a clinician chair. It's probably going to have an assisting chair. It's going to have a dental light, maybe radiographic equipment. And all of this can be contaminated by the patient or the clinician. Okay, so it's important that we understand the features of the treatment room, because we have to make sure that we are properly disinfecting the treatment room in all areas. Every treatment room also has to have proper ventilation, and the chairs are required to be 6 feet apart. So how do we properly disinfect the treatment room? Well, we are going to be using what we call wipes. We use here at LMU Optum One wipes, which is the picture on top. Some of you might be more familiar with what we call Cava wipes. They are the same thing, just different brands. The biggest thing when it comes to the properties of a disinfectant is that we want it to be a one-step, meaning that that one step is going to kill tuberculosis, the herpes virus, the hepatitis virus, the HIV virus. It's going, and along with a slew of other infectious agents. So we have to wipe down everything in the room, and we will be practicing this in lab. The things that we need to be aware of with our wipes is that we want them to be a broad spectrum. Okay, we want them to be antimicrobial over a large amount of infectious agents. We want it to be fast acting. All right, so once, when we're cleaning the room, it's going to be wet. It's going to look wet. And once it's dry, then that tells us that it's been properly disinfected. Now, that does not mean you can grab, a paper towel to dry it off. No, it needs that time to penetrate, to kill those, the vegetative forms that can form. We want it to be non-toxic. The surface compatibility. Now, these wipes will not corrode, but they do wreak havoc on our equipment. They tend to break down the fabric on our chairs over time and also our hoses. So if you start noticing a breaking down of the hose or the hoses or of the chair, just let somebody know so we can definitely fix that. We want it to be odorless. You will find that once we start disinfecting the room, there might be kind of an odor to this. It's a disinfecting odor. That's the best way I can explain it. If you do have an odor, you are more than welcome to wear a mask if you are sensitive to that smell. Once the room is properly disinfected and completely dry, then we're going to put some barriers on. Okay, we do have the tape that you see in this picture, the blue. The tape, the barriers, they don't work that great, got to be honest. If you want to try to use them, try to use them. Ideally, it would be nice, but I find that they don't stick very well to the equipment and they end up falling off throughout the appointment. But we do have, barriers for the patient's chair, the operatory trays. You'll see that as we go through, but we do want a barrier as much as we can. We have learned how to protect ourselves. We have learned how to disinfect our room. Now we have to talk about the instruments. So let's go through this process. Take a look at this upper big blue box, maybe gray. Okay, this is the cycle in which the instruments are required to be processed properly for sterilization. So the instruments need to be placed in a cleaning or a decontamination processor. Then once they are cleaned, and this is going to remove any biofilm, blood, saliva, maybe prophy paste, anything that collects on the instruments, this will be removed. Then the instruments will be rinsed and dried. They will be packaged appropriately and sealed. And then they're going to go through a sterilization process. And then once that is sterilized, it's ready for clinical use. So the equipment that is used for this is this top left picture. This is known as an ultrasonic cleaner. People may know it as a jiggler. And the bottom one right underneath it looks like a huge dishwasher. This is known as a hydrum. These are the two equipment processes that the instruments must be placed in prior to the actual sterilization process. Like I said, this is going to remove any blood, saliva, biofilm, anything that could be stuck on the instruments. Once they are properly decontaminated, then they are going to go through an autoclave or a statum. The Statum is the machine that's on the upper right. The Statum is good for single cassette instruments, or maybe, it's actually really good for what we call flash sterilization, meaning that if, say, you drop an instrument, we can put this instrument in the Statum, run it on an unwrapped cycle, and we can get that instrument back into your hands within 3 to 4 minutes. The picture below, this is called an autoclave. It's almost like a huge oven. And after the instruments are sealed and packaged, then they are placed in here, and then they undergo a process of steam sterilization. So let's talk about what types of instruments are going to be sterilized or disposed, okay? All instruments, no matter what, they have to be properly sterilized or they have to be thrown away, okay? There are three critical categories, okay? We have the critical items, the semi-critical items, and the non-critical items. The critical items are instruments that will actually penetrate soft tissue or bone. These instruments are required, mandated to be sterilized under heat sterilization. Some examples would be all of your dental instruments, scalpels, anesthetic syringes, any type of surgical instrument, okay? The semi-critical instruments, these are instruments that come in contact with the mucous membrane but does not penetrate tissue or bone. Now, these items either can be thrown away and disposed, or they have to be sterilized. It's one or two. It's one of the options. So some examples would be a mouth mirror or an impression tray. So we do have disposable mouth mirrors, and if it's disposable, we throw it away. For the impression trays, there are some that can be sterilized and some that can be disposed. So you have to determine, can this, item be sterilized? If not, it must be disposed of. Then we have the non-critical items. These are the items that do not touch the mucous membrane at all. So this is going to be like your eyewear, your dental chair, your x-ray unit. This is where the disinfection of the wiping system comes into play. With packing of dental instruments, all the instruments must be washed prior to being sterilized. So they have to be washed in that hydrum, in that, that dishwasher-like contraption, or they have to be placed in the ultrasonic cleaner. Again, this is to remove saliva, biofilm, blood, or any debris. Then the instruments must be properly dried, they must be packaged and sealed, and they have to be placed properly labeled, meaning that we're going to put a date on it, okay? The reason why a date is important is because if the instruments have been not used within a year, we're going to want to re-sterilize those instruments. So if there's no date on your instruments, I would not use them. We don't really see that this is an issue for dental hygiene because we use our instruments so quickly that we're probably using them like every day to maybe every other day. But it's also always important to put the date on that. And then all instruments needs to be placed in the proper autoclave. The modes of sterilization, the gold standard is going to be your steam under pressure. This is going to be your autoclaves. You've heard me say that before. This uses saturated steam under pressure. It penetrates and it kills spores, okay? When you kill a spore, it is considered sterilized, okay? Spores are the most virulent organism that's on this earth, and if it can kill a spore, it is considered sterilized, okay? So this is through moist heat. It's the gold standard. We love steam under pressure, okay? There is dry heat. This is usually more in a hospital setting along with chemical vapor. We do not use that as either, but we do use that intermittent use steam flash, which is sometimes that if you drop an instrument or whatever, we can put it in the statum, and that does use steam, and we can do it in uncycled. So we do have that option as well. And then there is a cold sterilization that is no longer recommended. It is called glutaraldehyde, and it was a process back in the day where you would have this tub full of this glutaraldehyde material or solution, and it would sit. The instruments would sit in this for about 12 hours, and then you would take them out, rinse them, and then use them back on a patient. It was absolutely disgusting. If you ever see this in an office, run. Do not put your instruments in there. It's not good. Okay, so we have to prove that the instruments have been sterilized, okay? And we do it kind of two ways, okay? So take a look at the upper right picture. You see a bag and it's circled and it kind of looks like pink, okay? The one that looks like it's inside the bag is considered the internal chemical indicator, and then the one on that looks like it's like above near the seal, that's considered the external chemical indicator. Now these indicators, if they reach the desired temperature within the autoclave, those two will turn dark brown, may even look black. If it turns dark brown or black, then absolutely use them. That means that this particular set of instruments were placed in the autoclave and they reached the desired temperature. Okay? If it is the same color as you see in this picture, don't use it. Okay? That means that the instruments are not sterilized and they cannot be used on a patient. The other way that we prove sterilization is through biological monitoring. There are two ways that this can happen. One is through the steam indicator strip. If you look at the picture, it's that rectangular box, that white and blue box. How this works is that there are two sleeves. One has an active spore. Well, they both have an active spore, but one of those goes in the sterilizer for a full cycle. Both strips are placed in this envelope and it's mailed off, and it's determined by an external entity on whether that spore had been killed. And if it was, it proves that the sterilizer is working efficiently and effectively and that the instruments are properly being sterilized. The process that we use here at LMU is the one above, the confirm. What that is those are vials, and that vial contains a live spore. And we put that spore inside of the sterilizer and we run it. And then we put it into the machine, and the machine determines whether or not the spore has been killed. If it is, then that tells us that this machine is working and that the instruments have been properly sterilized. So again, when the instruments are sterile, they need to be labeled, they need to be sealed, they need to be unopened, and they need to be placed in a dry area, okay? Again, they will be dated. If it's been more than a year, we'll want to re-sterilize them. And we just want to make sure that we're handling these instruments carefully until they are ready to be opened. If you find that the package has been ripped or torn, unfortunately, you cannot use those instruments. They need to be put back through the sterilization process. So make sure that you are reviewing your package of instruments, making sure that they are properly sealed and packaged with no rips or tears, and then they would be ready for patient care. Last but not least, water lines. So we use a lot of water in dentistry, and they're water lines, so there can be a lot of standing water within these lines, okay? And within water, even though we use treated water, Microorganisms still do form inside of these water lines and these tubings, especially when overnight. So one thing that we do is, well, first off, we do treat the lines and we do purge the lines, which you will be taught in lab. But before your first procedure of the day, it is required that you flush your water lines for 2 minutes. Okay? Please, please, please do not miss this step. Okay? Patients can get very sick and the water tastes very bad. And you want to make sure that these lines have been bled. So please, 2 minutes before you see your very first patient, and then we're going to run the water for 30 seconds in between each patient. Okay, so 2 minutes in the very beginning and then 30 seconds in between each patient. At the very end, we're going to run a suction cleaner through the lines to remove any saliva, blood, biofilm, prophy paste, or any type of sludge. We will train you on this, but this is required at the end of every single day. So hopefully this helps with infection control to have a better understanding of what we're looking for. You're going to have a lot of questions expected. I understand that. If not, when in doubt, ask the question. When in doubt, wash your hands. And we will be practicing a lot of these skills starting next week. Well, starting this week, actually. And it will be the foundation of creating an environment for yourself and for your patient for safety. Thanks.